Polymyalgia rheumatica is an inflammatory disorder, and it causes muscle pain and stiffness, especially in the shoulders and the hips. Signs and symptoms of polymyalgia rheumatica usually begin quickly, and they're worse in the morning. Besides checking your complete blood count, your doctor will look for two indicators of inflammation: erythrocyte sedimentation rate, the ESR, and C-reactive protein. However, in some people with polymyalgia rheumatica, these tests are normal or only slightly high. There's also imaging tests. Increasingly, ultrasound is being used to distinguish polymyalgia rheumatica from other conditions that cause similar symptoms. An MRI can also identify other causes of shoulder pain, such as joint changes. Polymyalgia rheumatica is usually treated with a low dose of an oral corticosteroid, such as prednisone. You'll likely start to feel the relief from the pain and the stiffness within the first 2 or 3 days. After the first 2 to 4 weeks of the treatment, your doctor might begin to gradually decrease your dose depending on the symptoms and the result of the blood tests. Because of potential side effects, the goal is to keep you on as low a dose as possible without triggering a relapse in your symptoms. Most people with polymyalgia rheumatica need to continue the corticosteroid treatment for a year or more. The long-term use of corticosteroids can result in serious side effects, including weight gain, loss of bone density, high blood pressure, diabetes, and cataracts. Leeds researchers used the electronic health records of nearly 40,000 people who had polymyalgia in England between 1997 and 2017. The researchers observed there was a higher absolute risk of infection when the patients were taking the oral steroids than when they were not taking them. 55% reported getting at least one infection, 26% required hospital admission, and 7% died within 7 days of the diagnosis. According to researchers, the most common infections reported by the respondents are lower respiratory tract infections. This accounted for 27% of the infections. Conjunctivitis was reported by 9%, and shingles was diagnosed in 7%. Joint pain. Joint pain can simply be a normal part of aging, but it can also signal possible arthritis symptoms. There's 4 major factors that are common among all patients with arthritis: joint swelling, joint stiffness, joint pain, and difficulty in moving or decreased joint flexibility. Of the 4 factors, pain is the most prominent symptom among arthritis patients, and it can develop into a serious problem that affects various parts of your life. Osteoarthritis or degenerative joint disease, rheumatoid arthritis, fibromyalgia, and polymyalgia rheumatica. Considered less common than the other types of arthritis, the polymyalgia rheumatica involves the joint pain and the stiffness in large joints of the body, like the hip and the shoulders. You could check out my video on rheumatoid arthritis for lots of natural supplements, herbs, and diet advice to help to treat this condition. Polymyalgia symptoms are linked to and are worsened by a lack of sleep. Melatonin supplementation can not only improve sleep, but it also increases growth hormone levels, and this can help to speed up the healing and to relieve arthritic pains. You can check out my other video on herbs to help you sleep, and my video on melatonin for more coping mechanisms. Other rheumatic disorders, like rheumatoid arthritis, are also associated with an increased risk of depression, and this can adversely affect your outcome. The long-term nature of polymyalgia rheumatica, its associated disability, and its treatment with steroids means that polymyalgia rheumatica patients may be at the increased risk of depression. Some natural ways to help deal with depression are ensuring that you have sufficient sleep, reducing inflammation with natural anti-inflammatories such as curcumin and boswellia, decreasing the toxic burden on your body with antioxidants and glutathione supplementation, increasing neurotransmitters with precursors such as tryptophan, melatonin, theanine, and choline sources, taking herbal antidepressant compounds such as St. John's wort, posinol, and albizia. Findings show omega-3 fatty acids can help to lower blood pressure. They can help to reverse immune system responses to inflammation and protect against the recurrence of polymyalgia rheumatica. They can also help with depression-related effects of polymyalgia. Typical doses are 3 to 9 grams per day of an EPA-DHA molecularly distilled fish oil blend. When you're on a steroid treatment for polymyalgia rheumatica, you're at an increased risk of osteoporosis, fractures, and bone damage. You should get a 25-hydroxy vitamin D blood test and then supplement accordingly to correct any deficiencies with vitamin D3. Vitamin D3 works synergistically with vitamin K2, and most people are deficient in this also. The maximum amount of K2 that your body can absorb in a day is 300 micrograms. Therefore, supplementing with more than this is not necessary. As calcium is also recommended with vitamin D3 and K2, you should note that due to the acidic nature of pasteurized dairy, it may be bad for your health and worsen your condition. Therefore, in order to obtain your calcium, you should eat calcium-rich vegetables, and if consuming dairy, make sure that it's unpasteurized milk, which won't have the denatured proteins, and it will contain an abundance of enzymes and probiotics that can help to boost your overall health. You can see my video on joint health to learn more about herbs and supplements that can help with sore and damaged joints. This may accompany the polymyalgia, such as supplementing with collagen, hyaluronic acid, and MSM. Boost your body's own steroid production and regulation. Natural steroids can help to fight inflammation, control your body's metabolism, and also promote good sleep. Supplements of vitamin C and B6 are known to help the body produce and regulate steroid hormones. The best form of vitamin C is liposomal vitamin C. You can learn how to make this cheaply and easily in an ultrasonic cleaner. The next best form of vitamin C is a non-acidic pH buffered form, with the worst kind being cheap acidic ascorbic acid. Vitamin C's action is enhanced when taken with bioflavonoids such as quercetin, which is naturally found in elderberry juice. Cholesterol is required by your body for the production of its hormones. Therefore, coconut oil, avocado oil, butter, and animal fats would be advised. Pregnenolone supplementation is also a necessary precursor for your body's hormones, such as DHEA, testosterone, and estrogen. Stress can deplete your pregnenolone levels. I've seen massive benefits to a patient who was suffering with a severe case of polymyalgia, who started consuming 1 to 2 grams of deer antler velvet each day in combination with some B vitamins and other adaptogenic herbs. Adaptogenic herbs are said to balance any imbalance that the body is facing. Some of these adaptogenic herbs are Panax ginseng, Eleutherococcus ginseng, Schisandra berries, ashwagandha, and tulsi tea. Licorice is another adaptogen. Whole licorice can be an effective treatment for inflammatory disorders like polymyalgia rheumatica. It's considered as one of the top 3 herbs to cure polymyalgia naturally. Roots, capsules, and tea are also available, and they can be taken at doses of 5 to 6 grams per day. A concentrated extract could be taken at 250 to 500 milligrams per day. The intake of licorice capsules can lower a reliance of patients on prednisone or other steroidal drugs. Turmeric tea has a strong anti-inflammatory property. It can ease inflammation in polymyalgia rheumatica patients. It's also effective in easing the swelling of affected joints in the polymyalgia rheumatica patients. A compound in turmeric known as curcumin is effective in reducing pain caused by polymyalgia, as well as in patients with osteoarthritis. Another wonder of turmeric is its ability to strengthen our immune system, even in people with an immune disorder. Doses of curcumin range from 2 to 5 grams per day. Its poor bioavailability can be increased by consuming it with BioPerine, black pepper extract, fish oil, coconut oil, ghee, or butter. From the same family as turmeric, another root, ginger, can relieve polymyalgia naturally too. Consuming ginger reduces inflammation, eventually relieving even the pain caused by an inflammatory disorder such as polymyalgia. A small amount of ginger is said to be more effective than prescribed painkillers. Ginger contains gingerol, and this targets pain pathways, but it also relieves inflammation. This could be taken as a tea or added to cooking. There's many ways that you can help to relieve the symptoms of polymyalgia. Check out my video on arthritis and my video on joints to learn how to ease any pain. Adopt a sugar-free, antioxidant-rich, anti-inflammatory diet to help to heal your body. You can check out my videos on antioxidants, on natural anti-inflammatories and chronic inflammatory diseases such as autoimmune diseases to learn natural ways to help heal yourself. Check out my video on sleep to find easy ways to help you rest and recover. Add some omega-3, adaptogenic herbs and mood-boosting herbs to help increase your optimism and thus reduce your stress levels. Try to supplement your body with the nutrients that it needs to make its own steroids, such as cholesterol and pregnenolone. Make sure that you correct any nutrient deficiencies, such as magnesium, zinc, and vitamin D. Try to replace your prescription steroids with safe, natural alternatives that don't come with the same strong side effects that the drugs do. Try probiotics and trace minerals to help to naturally balance your immune system. Be sure to watch my other larger presentations on the natural treatment of fibromyalgia and on the natural treatment of chronic fatigue and ME, as these are all related. For more information about the herbs or supplements discussed in this video, check out my website.